Hello everybody, thanks for coming to listen to me today. I'm Katy Harris. I work for Coedlail, which is a project of the Small Woods Association, and our mission overall is to reconnect people and woodlands in Wales. So I don't come from a background in working in the mental health field. However, over the last couple of years, we've been heading in the direction of working with all kinds of people with chronic health conditions, including mental health. So I'm here today to tell you a bit about the work we've been doing over the last 2 years, getting people with mental and physical health conditions out and about in the woodlands, doing a range of activities. So I'm based up in Machynlleth in mid Wales, and since September 2010 we've been funded by the Forestry Commission Wales and CCW as well to get going some pilot projects, one in mid Wales near Aberystwyth and the other one in Treherbert in Rhondda Cynon Taf, to investigate how we can get people out and about for health benefits. And the idea is very much a partnership with other local organisations. Our own staff are based mostly in mid Wales, and we've managed to employ a local project officer down in Treherbert as well. But very much it's about working with organisations who are engaged with and know the beneficiaries on a long-term basis, rather than coming in, running some woodland walks again and walking out again. So very much we're aiming to work with organisations who at the local level are engaged in the health sector, community development sector, and bringing them together with organisations working in the environmental sector and trying to develop activities and create the capacity to run outdoor activities specifically targeting people with chronic health conditions. I think the health benefits of being active outdoors have already been talked about today and have been fairly well proven by numerous research. There's physical and mental benefits. Being outdoors appears to relax people from stress and mental issues, and being physically active has obvious health benefits, but that it includes mental health benefits as well as physical. And doing something outdoors with other people gives opportunities to socialise, which also means people enjoy better health. So why specifically woodlands? Well, for a start, we've got loads of woodlands in Wales, and I think even if you live in a big city, there's usually a woodland on your doorstep within a kilometre or so. Not everybody knows they're there, and we've had people taking part in our project who've said, oh, I live 50 metres up the road and I've never been down here, didn't know this place existed. It's quite astonishing how you can have a lovely place on your doorstep and never actually go out there. They're free to visit. It's not like signing up for a gym where you have to pay your annual membership. So we can take people out there, and quite often we find once they've been there, they'll be back at the weekend with their dog or their kids or whatever. And there's quite a lot of research which suggests that woodlands are specifically therapeutic, particularly for mental health. They're a varied natural environment. There's all kinds of theories. I don't know if anybody's heard of the biophilia theory, which is our affinity to nature, and the fact that that actually has a relaxing effect on people. Yeah, the natural environment, I think, has obvious benefits as well in terms of relaxation and making us just generally feel good. I think most of us would feel better, clear your head if you go out for a walk. So some of it's really obvious. And woods in particular do seem to be a nice environment to get people doing things in, and somewhere that not everybody goes. I think that's the other thing. There's quite a few publications. I've just listed a few of them, 2 from the Forestry Commission and 1 which you may have come across that was on ecotherapy by Mind, which are available, which look at some of these issues in more detail. And there's lots of research into this subject as well. That's just a selection of that I'd found that are available online. So what have we been doing? We've been working in 2 locations, and in Aberystwyth we're running 3 different programmes in a range of local woodlands with a whole range of activities, from bushcraft to walking to forest gardening and some environmental conservation as well. And partners include National Exercise Referral Scheme, Mind, and a variety of locally based support organisations, mostly voluntary sector support, but also social services. And in Treherbert we've now actually got 3 groups. We've got 2 woodland gym groups who go outside and do kind of gym style exercises but in the outdoors, and another group which does environmental conservation work. And it's surprising how physically active it can be, cutting down brambles and building benches and things like that. So people kind of sniff at that when in terms of actual, getting physical exercise, but there's physical exercise benefits to that as well. What we found is that it's the variety of activities that keeps people going, and we've got particular success in Aberystwyth with a group that we're running in partnership with Mind, which has ended up focusing very much on the sort of woodland management and bushcraft side of it. They started off doing walking, but the group that turned up weren't that interested. They'd done walking before and they can go for walks by themselves, and Mind had done a walking group and it had success for a while, and then some of it tailed off, and then they tried it again. But this was something new, this was something different, and it was something that really fired up the imagination of the participants who came along. And very much we've tried to tailor the different groups to the interests and needs of that group. So the other group in Aberystwyth is run mainly with a focus on physical activity in partnership with the National Exercise Referral Scheme, but it obviously caters for all kinds of health issues. And that's much more based on kind of walking and woodland gym and things like that. But this group, they weren't interested in that. They wanted to do fire lighting and woodland management, and really get engaged in all these new sort of skills that they hadn't had an opportunity to try before. And I would say that the people who have come to us with mental health issues are probably the people who appear to be getting the most out of our activities and are most focused on specifically on the woodland aspects rather than just getting outside and outdoors. So we've got we're getting quite a lot of success with people coming back and wanting to continue the activities. So what's working well? The partnership's working. It's certainly been very beneficial, for example, working with Mind in Aberystwyth, because they have an ongoing relationship with the people who come. They meet them at several different activities in the Mind Centre and can then encourage them to come to our activities. It makes it less scary. They also can suggest things to us. We've got a support worker coming along to most of the activities, and he can kind of help us to tailor it where we need. And they also have expertise, so quite a few of our members of staff went on a mental health first aid course, which was run by Jan, I think, who's sitting there in the audience. That was really valuable, actually, because many of our staff come from a woodland activity background, and that while they're super at bushcraft, they may not have thought about the challenges of working with people with mental health issues. And I think to be able to be confident and to support people in the way that they need, that was very helpful. I think one of the things we're looking at is if we can leave a legacy of a whole load of woodland activity leaders who know about working with adults with a range of health conditions, plus people who maybe work in the health sector who are more convinced of the benefits of going outdoors and have the skills to take groups out in the woods, then that's the best legacy we can leave at the end of a project, really. But everybody seems really keen that the activities continue. We do have an evaluation, we've got a questionnaire, and we're collecting some qualitative comments as well. And we're measuring the amount of physical exercise people are prepared to undertake, and we're measuring general feelings of well-being through the questionnaire. And even over a short period of sort of 6-7 weeks, we've noticed people are showing an improvement in their health, or how they perceive their health. And particularly valuable was the sort of one-to-one support sessions with participants to support the evaluation and talk to them about what they're getting out of it. Barriers. Access to woodlands, well, that's what we're there for, really. That's what we do. But it's surprisingly hard sometimes to find out who owns the woodlands and get the right permissions to light fires, chop down trees, that kind of thing. So some woodlands we've got a better relationship with others. Some woodlands will go for a walk and that's fine, we just do that. Other woodlands we've used on a more frequent basis, and we're able to take a role in the woodland management, which gives people a feeling of ownership of the local area. And I think that's quite valuable in making people feel they're contributing something as well as just trying out an activity. Variable numbers of people. You'll have 15 on a list and only 4 will turn up. But I think when you're working with people who do have health conditions, it's not surprising that some of them are too ill to turn up sometimes. But what we do find is that people who come back. It's actually getting them to turn up in the first place. That's that they'll put their name down the list and then we'll never see them. But once they're there, we've had quite a high success with people coming back and staying. And yet we've got forms and questionnaires, and we have to do them for funding and so that we know that what we're doing works. But it doesn't suit everybody sitting in the woods in the rain filling out questionnaires on a piece of paper. So we try and make that as fun and as easy as possible. As I mentioned, training for our leaders has also been a valuable point. We started with a training needs analysis. We have some leaders who have skills in woodland activities but have never worked with the kind of beneficiaries and clients that we're working with. We have other people who come from a health background and didn't really know much about doing things outdoors in the woods. So we had a Skillshare day in the 2 project locations at the beginning of the programme and shared skills so we all had a common understanding of what we were trying to do and how. We've supported individual leaders to go off on professional training, including increased bushcraft skills, mental health first aid, walk leader training, and a couple of courses we've run with external trainers, like the mental health first aid course with Mind, and we ran a specific first aid course targeted at working in the woods to make sure that everybody had the right standards of first aid training. And we've been trying to run seminar days as well to promote best practice and share what we're trying to do. So I've just got a couple of a few photographs of what we've been doing, and I always find that I haven't done graphs or anything of how much people's health have improved over 5 weeks. I always find that the comments and the pictures actually speak far better than a graph. So I won't read the comments out. I'll let you read them yourself. I'll just I'll turn the page and let you see a few of them, and then the comments can speak for themselves, really. So you see the group at the top is in Aberystwyth doing Nordic walking, and the group at the bottom is a woodland gym exercise where they do stretches. And what's worked really well in the woodland gym group is the environmental conservation group has built them outdoor gym equipment. So they had they cut up big logs, kind of big logs like that, and they made weightlifting things with a big rope between them. So they've got kind of 2 logs and a big rope, and then the gym group's been able to use this outdoor equipment. So it's quite a nice symbiosis between the 2 groups. We had a litter pick to improve the area, which was beneficial to the local area as well, and got people feeling better about the place we were working in. And we tried a day of horse logging as well, where the participants got to do things with the horses as well. And they felled some trees, and the horses took them to the other end of the woodland, which was obviously quite a novel experience for everybody on the day. We weren't sure they were all going to get up that hill at the beginning, but everybody made it to the top. We were really impressed. We had a flat option if they wanted to go round instead. So, those are the homemade weightlifting things that they did. And that's the group that worked with Mind in Aberystwyth. We've had a few people who've said to us, this has now become the focus of my social life. I don't know what I'll do when the programme finishes. So we're trying to work towards having the activities available on an ongoing basis. That was a qigong session that we tried once out in the woods. It's a bit windy that day. You can't really tell from the picture, but not too bad. It was okay. People enjoy making things out. When they've been cutting back the holly, they also then made some baskets out of them, and that meant there was a kind of physical option. And then if you're a bit tired of cutting down holly, you could sit down by the fire and have a cup of tea and try making a basket, which gave people a bit of a rest as well. I think the social aspect is one of the most important things, and it's nice when the group, we try and get a group that's coming regularly, and lighting fires, there's something about lighting fires that people just get a lot out of. You know, it's something that you don't really have the opportunity to do unless you have a woodland in your own back garden, and it always appeals to everybody, it really does. It also warms people up in February when you've been out in the woods all afternoon. Yeah, so I think that's it for me, just a brief introduction to what we've been doing. We're applying for funding at the moment to expand to other areas of Wales, and if successful, we'll be running activities in Neathport, Talbot, Anglesey and Wrexham as well by next year. So if anybody here is working in any of those areas or in our existing areas, Aberystwyth or Treherbert, we'd be really interested in talking to you. We'd be really keen to work with any other organisations who would like to refer people on to us for an activity programme, bring people along for a bit, or just talk to us about how they could be involved in